Senator Kirsten Gillibrand, one of the sharpest voices in the Democratic caucus, sat down with healthcare leaders, including Dr. Smith, Dr. Gross, and Dr. Littles to confront a crisis Washington has ignored for far too long. Our doctors are burning out, and the system is breaking them. While the administration spent gutting healthcare protections, these witnesses laid bare what bureaucratic overreach actually looks like: prior authorizations that delay care, training gaps that hollow out rural America, and a Medicare model that may only make things worse.
Ranking Member Gillibrand.
Thank you, Mr. Chairman. Mr. Feist, in your testimony, you discussed how administrative burden is an underlying cause of physician burnout, impacting time with patients and pushing doctors beyond even extended working hours. Your foundation's Impact Well-Being Guide provides guidance on how hospitals and health systems can address these burdens through quality improvements and quality improvement projects. Could you please share a brief example of how healthcare providers successfully reduce physician burning by using your Impact Well-Being Guide?
Absolutely. The Lorna Breen Act created the Impact Wellbeing Guide, and NIOSH partnered with our foundation and our all-in national coalition of over 37 of the largest professional associations to create this leader retraining guide. And what we have done is we've implemented this guide across the United States, particularly in Virginia, North Carolina, now in New Jersey, and as well as in Wisconsin. And what we saw in Virginia after doing this work were decreases in the amount of time that clinicians were spending the electronic medical record before and after work by significant numbers. In some cases, 3 to 5 minutes per patient. In some cases, 10 to 15 minutes per patient. Huge decreases there. In addition, standing orders for pharmacy refills, things that keep the pharmacists, the patients, as well as the physicians burdened with bureaucracy. All of those things, using the Impact Wellbeing Guide, decrease the amount of time that folks were spending outside of direct patient care, increased their well-being, increased and decreased their burnout.
Thank you. Mr. Smith, Dr. Smith, your testimony describes how Medicare Advantage's burdensome prior authorization requirements significantly contribute to physician burnout and can harm patients. Over 60 senators, including myself, are pushing to pass the Improving Seniors Timely Access to Care Act to streamline the prior authorization process and help address some of these widespread concerns. Yet CMS's new wasteful and inappropriate service reduction model, also known as the WISER model, expands prior authorization into traditional Medicare and utilizes a new non-standardized approach that's inconsistent with the existing federal regulations. How will the WISER model increase administrative and patient burdens in traditional Medicare, and how might this drive burnout among physicians in states where this model is enacted?
I think what you're going to see is more prior authorizations needed. That's going to add burden to the staff. There'll be more denials. That will add burden to the physician to either fight the denial or just to decide it's just not worth the fight.
Right.
Now you have patients not receiving care. Patients don't receive care. I believe that they will get sicker. They'll end up in the emergency room, ultimately the hospital, and we're going to drive the cost of health care up.
Yeah.
My dad's 94. He went to the doctor this week while I was up in Philadelphia visiting him, and the doctor decided that he needed a CAT scan. I would bet a lot of money that that would be denied if you did a prior auth on that.
Right.
You know, we spend a lot of time telling doctors, you know, you're in charge. You're the quarterback of care. We actually increased the E&M codes, but every step of the way we question what they do.
Yeah.
So I think we would just be contributing to the burnout of doctors if we move forward with that.
I agree. Dr. Gross and Dr. Littles. Dr. Gross, in your testimony, you highlight the mismatch between how physicians are trained and the regulatory environment that they practice in. You say that when physicians enter the workforce, they are clinically competent but structurally unprepared to operate smaller rural practices. How does this mismatch drive physician burnout and contribute to consolidation?
So one of the things that I've noted is that when people are graduating from training, I'm kind of old school. When I went into training, I had full practice management training in my practice. And that doesn't really happen to a degree. I mean, it's still sort of required, but when people graduate, they do not have the full practice management. How do you have compliance? How do you comply with OSHA? How do you hire? How do you fire? How do you set up your structure? How do you negotiate contracts? That is all stuff that I learned in my training, but it's not really being taught to that degree in most places because most people are being trained to be employees in an outpatient or an ambulatory setting. And so if you're trying to then go from training into a rural healthcare setting delivery where you need to be running your own practice, they're not prepared for that. And so people are just not even stepping into that environment, and it's leaving a huge void in the rural communities.
Thank you. And Dr. Littles, in your testimony, you shared how medical schools and residency programs in Florida recognize this mismatch and are incorporating activities to help students prepare for the impact of the profession's administrative burdens. Please describe some of these initiatives and discuss how medical students and trainees have responded to these trainings.
Sure. So we all know that medical school is a stressful environment, going through the process of training to become a physician. So we put in support systems, for students to help guide them through this, because we recognize that they're going to be facing stressful situations throughout their career. So having access to on-site counseling that they can access right there at the college, without feeling that tension of, is this going to affect my licensure later on, and prohibit me from being licensed or practicing medicine. So activities like that, having wellness activities so that they learn to take breaks, because at the end of the day, we're all humans before we're physicians, and they need to be able to take breaks, make sure that they're eating properly and getting rest and maintaining connections to their support systems that they had even before they came to medical school, and training them and with those activities, but also recognizing that these other stressors that they're going to face as practicing physicians are there as well. And so having them actually training with those physicians, our students and our residents get to see what our attending physicians are facing in their practices. So when they're having to deal with these issues like prior authorization and denials, and patients not being able to access the appropriate lab or the appropriate X-ray facility, they're seeing this as a part of their training, even in medical school. And as Dr. Gross said, those requirements for that practice management training is there for our resident physicians. But a lot of them are not focusing on that. Certainly not early on in their residencies. They're not focusing on that because they're not having to be the ones ultimately responsible for it. As they get closer to graduation, they tend to start paying a little bit more attention to it. But it is true that more physicians are employed today than even 10 years ago, and certainly more than 20, 25 years ago. More and more of them are entering employed situations, which is, in many cases exacerbates a lot of these issues we're talking about.
Senator Kirsten Gillibrand of New York, a member of the Senate Health, Education, Labor, and Pensions Committee, one of the few members of this chamber who seems to understand that healthcare policy is not an abstraction but a daily lived reality for hundreds of millions of Americans, led a line of questioning. Today, that should be required viewing in every hospital boardroom, every insurance company headquarters, and frankly, every corner of the West Wing. She questioned 4 witnesses. Each one told a different piece of the same devastating story. And when you put those pieces together, what emerges is not a picture of a system in need of minor repair. It is a portrait of systemic failure engineered, maintained, and perpetuated by the very institutions that claim to be fixing it. Mr. Feist sat before the United States Senate and reported that his foundation's Impact Well-Being Guide, developed in partnership with NIOSH and a coalition of over 37 major medical associations, has produced measurable, replicable results. In Virginia alone, clinicians using the guide reduced the time they spend in electronic medical records by up to 15 minutes per patient, streamlined. Burnout went down, well-being went up. The data is there, the model works, and yet, here we are, still treating physician burnout as though it were a mystery rather than a policy choice. Then Senator Gillibrand turned to Dr. Smith, and the conversation shifted to what argue is the single most destructive bureaucratic mechanism in American healthcare: prior authorization. This is the daily reality of practicing medicine in the United States of America in the year 2025. And Dr. Smith told this committee, in terms that left very little room for ambiguity, that the result is predictable and catastrophic. More denials, more patients who simply do not receive care, more people getting sicker, more emergency room visits. Senator Gillibrand then did something unusual for a Senate hearing. She made it personal. She told the committee that her father, 94 years old, visited a doctor this week in Philadelphia and was told he needed a CAT scan. And then she said, with the kind of quiet certainty that comes from lived experience rather than briefing papers, I would bet a lot of money that that would be denied if you did a prior authorization on that. Rural hospital closures have accelerated. Rural physician shortages have deepened. The absorption of independent practices into corporate health systems continues unabated because they have built a training system that feeds the machine rather than the people. Finally, Dr. Little spoke about what Florida's medical schools are doing to address this crisis at its roots: wellness programs, on-site counseling, deliberate exposure to the administrative realities of practice during training.